Is Houston Newsmakers with Cambrell Marshall.
Governor Abbott announced this week the plan for the state to reopen in the wake of the COVID-19 shutdowns deemed so important these past many weeks. It'll be a limited reopening, he said, with restaurants, retail stores, malls, and movie theaters able to open to 25% capacity. The entire process to be monitored through increased testing and new coronavirus cases. Joining me this morning is Congressman Dan Crenshaw, a Republican who represents the 2nd Congressional District and who weeks ago called for a balanced reopening of the economy while battling this health crisis. Congressman Crenshaw, thank you for joining me this morning. A couple of weeks ago, you took a page from your Navy SEAL training. You said, you know what? It's our tactical retreat. Should be over. It's time to go back on offense. Talk about how you propose, and obviously the governor is starting to do that now as well. How do you propose all of that being done while we balance the health needs of the people as well?
Well, I propose we do it exactly as the governor's doing it. I think he listened to a lot of different advisors, myself included. Not that I'm an advisor, but I do have conversations with them about this. And listen, the more we learn about the virus, the more we understand it, the more we understand who is vulnerable, how it spreads, the better equipped we are to risk mitigate. That was always my point. And we can look around the world and see other case studies. We can see how Sweden is faring. We can see how other countries have done it. We understand what happens in places like New York with high population density, but we also understand that we aren't like New York. We're not even close, actually. We don't even have subways here. So there's no reason to think we're like that. We always, I think in the panic that ensued over the last couple of months, we set forth, I think, a lot of problematic critical thinking methods, one of which was this obsession with the shape of the curve. Now, that's important, but it should inform your hospital capacity, and you have to compare those two numbers. And in Houston, our hospitals were never overwhelmed. We always had significant amounts of PPE, and kudos to our hospitals, by the way. I've talked to them. They bought PPE months and months ago. And that should have been happening around the country, or around the entire country, because what happened in the last couple of months, of course, was places like China were limiting exports of much needed PPE manufacturing. It's a different subject. But once we start to gather all this data together, we learn more about how to risk mitigate, and we understand that we can confront it. There was this idea that we could just stop the spread in its tracks was always false thinking. That was never going to happen.
Yeah, and
we have to mitigate.
And I think a lot of the medical experts talked about that this is going to be around. Dr. Fauci's been saying this as well. This is not going away. It's going to be around. It's how you deal with it while it's here. You indicate a need for, I've seen your writings as well, an increased testing. You've talked about that. Is that something that's really critical as well to get a handle on just how it's spread in our community and how we can continue to control it? How satisfied with you on what's going on now in terms of the testing? Right now, we're not anywhere near what the medical experts say we should be in terms of the amount of testing that's being done.
I keep hearing that, and again, I question where they're coming from on this at this point, because we have a lot of testing. We have excess capacity testing right now. We have less people going to get the tests than we have tests available. Okay, so that's a really important point, and this is especially true in Texas. All right, the way we do testing is what's actually going to be important in the future. How we do that sample testing. Are we testing samples in each business moving forward? It's the surveillance testing that's important. I'm getting really sick of the critics of reopening just screaming testing, 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 as if that's a counter argument.
Right.
And they never say, like, okay, well, what's the right amount of testing? I'm really tired of the lack of critical thinking, and listen, as policymakers and as leaders, we have to listen to the ultra cautious public health care experts, and we also have to listen to these mom and pop shops that might not ever be coming back. We have to listen to the people who are not getting their medical procedures done because they couldn't get into a hospital in time.
Right.
Okay, we have to listen to people who are thinking of committing suicide because they've lost everything.
Right.
There are balances, and that's what leadership is. And so I'm really proud of Texas for leading the way.
I know that one of you talked about one of the statistics. This is from Harvard, by the way. You know about Harvard. You've kind of been there.
The Texas A&M of the East.
Yeah, they indicated that the amount of testing should be a rate of about 152 people per 100,000 population, and Texas is doing about 46 per 100,000. Now, obviously, that doesn't take into account the counties that we have that are well away from any centers, and so they're really widespread. So that's where the disconnect may come in. But anyway. anyway, those numbers.
There's other studies too. So there's so many ways to look at that. That's a very generalized way of thinking. Maybe that's the right way of thinking in a very dense population. Another way of thinking about this is the following, and I've heard this from experts as well, which is how many positives are you getting per 100 tests?
Right.
That's another important indicator. If you're only getting one, then you might be over testing. If you're getting 50 per 100, then you might be under testing. So a lot of people say about 10 is about the right rate, and that's actually kind of what we're seeing in Texas. So it actually indicates we might be doing it about right. I still think we should increase our sampleized testing. I don't know if sampleized is a word, but I think it works.
We just made one up. That's fine.
Where you're asking businesses to do sample testing, periodically, and that way we identify outbreaks early.
We had a number of, I think Texas had about 50 people who died, was the biggest one-day leap. Is that one of the areas you look at as well, the optics of how many people are going to be dying from this as we continue to reopen? I mean, we're going to reopen. That's the reality. People are going to continue to die. What we have to continue to do is to protect our vulnerable population. Again, we know more things about this virus than we did a month ago. We are very sure now who is vulnerable and who isn't. Right.
It's incredibly unlikely that you'll even feel very sick if you're a healthy person and middle age or young. If you're older, I think you should probably continue to shelter in place. If you have serious underlying conditions, and those are listed by medical professionals at this point, then you have to be more cautious. But the rest of us can get back to work. And again, you can't stop the spread.
Right.
We have to stop telling people that. You can slow it so that our healthcare system can deal with it. Let's also keep in mind our hospital capacity in Texas is massive. This is one of the benefits, by the way, for everyone listening, of having our private healthcare system in America. We have always been very much better equipped to deal with this than all other countries, Britain, Canada, even Germany. Like, trust me, just by the numbers, how many ventilators we have, how many ICU beds we have far more capacity here. And we're ready to deal with it. Can I add one more thing? We're getting into the summer here. We now know also, which we didn't know this before, but we know it now. There's more studies coming out. If it's hot and humid, the virus can't survive nearly as long. It's a further risk mitigation measure. And guess what the weather's like in Texas?
Last thing,
so
we're going to continue. We're going to continue our conversation on Newsmakers Extra. But I want to ask you one more thing. How disappointing is it for you for the partisan politics to be playing such a big role in the United States effort to solve an issue that has nothing to do with partisan anything? But partisan politics has really permeated every bit of the discussion about how we solve this problem.
Well, it's been incredibly frustrating, and I could go on forever about that. You seem to be very outspoken about it. I'll say a couple of things. I wrote about this in The Hill in an op-ed weeks ago, a long time ago, before this was even had really come to a head. But what I wrote is this: there's going to be really bad faith, disingenuous opinions and commentary and critique made against those who want a staged, reasonable reopening. People are going to say, well, how many lives is it worth to save one job? That's what they're going to say. And it's going to be made in bad faith because that's not the right question. You can't ask that question. I could ask the same question about car accidents. I could say, you can't get on the road anymore. Okay, and I'm a better moral person than you because I want to save 40,000 lives a year, and you don't. But of course we don't say that. We live with an element of risk and we balance things. So I called this out a long time ago, and lo and behold, that's exactly what happened. I don't understand why somehow that the debate between reopening and staying locked down has somehow fallen along left and right lines. It doesn't make sense. And I think if you talk to normal people here in Houston, just regular people, I think people want to get back to their lives. They want to be trusted to risk mitigate. I believe we can trust the American people.
We want to talk more about this on Newsmakers Extra. Congressman, thank you for being my guest this morning, being willing to do this Newsmakers Extra. I want to remind everybody else, you go to Newsmakers page on Click to Houston.